Writing a shift-to-shift report isn't just a formality, but it is a lifeline practice for patients' safety. Welcome guys to Nursing with Jibril. In this video, I will be showing you a step that you can use, a professional step that you can use to write a shift-to-shift report. Without further ado, let us dive in. So how do you write a shift-to-shift report? Before the how, let's talk about why. Why is it important to write a shift-to-shift report? Well, one of the most important points would be writing a shift-to-shift report would give the next nurse that is stepping in the chance to know everything that was done during your shift. And this would include every caregiving, laboratory investigations, physician's recommendations, and the list goes on. Now let's discuss about how do you write a shift-to-shift report. I'm going to give you this abbreviation called the I-SBAR. The I-SBAR would be your best friend. It is standard, well-structured, and commonly used in healthcare settings. Now the I here stands for identification, the S stands for situation, the B stands for the background information, and then the A stands for assessment that you did for the patient, and the R stands for recommendations. Now let's begin with the I identification. In this I identification is where you identify your patient. The name of your patient, the room at which your patient was admitted in, or the ward at which your patient is in. The S, on the other hand, stands for the situation of your patient. What is currently wrong with your patient? The problem your patient is currently facing, or the response to the problem in which your patient is facing. Now, that is the situation. For the background information here, it tells us the medical history of the patient. What is the past medical history of the patient? That is, if the patient actually has any. And then the A is the assessment for the patient. Patient's vital signs, patient's assessment, any assessment that you did for the patient. And lastly, the R stands for recommendations that you recommend to be done for your patient. There you have it, the I-SBAR, which helps you to structure and break down steps in which you can write a shift-to-shift report. Having said all this, I am going to give an example scenario, and then let's see if you can break them down into identification, situation, background, assessment, and recommendation. You can pause the video and look at this report written for a patient, for a female patient called Mrs. Jane. Welcome back. Were you able to get it right? Were you able to break this shift-to-shift report into these various I-SBAR abbreviation? I trust you were able to. And if you weren't able to as well, it's fine. The attempt counts. It takes time. With time, you will be able to get used to writing a good shift-to-shift report. Now on the screen, I will break it down in highlights so that you can know the abbreviations, how they have been broken down in this particular scenario. Now this portion refers to the identification, where Mrs. Jane is being identified by name and by room. The next paragraph is the current situation of Mrs. Jane. It tells us that Mrs. Jane has a problem of respiratory system. And then beneath it is the background information of Mrs. Jane, the history of Mrs. Jane medical issues. Next to that paragraph, discuss about the assessment that you did for Mrs. Jane, telling us the vital signs of Mrs. Jane that you've taken and more to that. And lastly, the last paragraph discusses about the recommendation that was given to the next nurse shift for Mrs. Jane. And there you have it. It isn't difficult, it is as simple. But with practice, you would get used to it even better. Practice makes more better. So guys, there you have it. If you like this video, you can hit the like button. And then if you have more hacks and more tricks in writing a shift-to-shift report, you can also leave it down in the comment section below. And please subscribe to my YouTube channel for more videos like this. Thank you guys and love you. Bye.